everybody to the March episode of The S Word, a podcast about suicide prevention. I'm Sarah Kolbeck. I direct the Division of Suicide Research and Healing at the Medical College of Wisconsin in our Comprehensive Injury Center. And we're continuing our theme of host interviews this month by having a conversation with Jacey, who is the research program coordinator for our division and who has hosted this episode in the past and stepped in for me. So really excited to talk to Jacey about the work that she does today. But before we get started, I just want to remind our listeners that this episode will discuss issues related to suicide and suicide prevention. And so if you have any concerns about yourself or a loved one, please reach out to the resources that are available. One such resource is the National Suicide and Crisis Lifeline, which you can reach by calling or texting 988. Another resource is the Crisis Text Line, which you can reach by texting the word TALK to 741-741. Both of those resources will connect you with crisis counselors who can help you with whatever you need. And if you need a break from this episode as we are talking today, please feel free to take that break and take care of yourself. All right, so I am really excited to introduce Jacey, who is, as I mentioned, the research program coordinator for our Division of Suicide Research and Healing, but does a lot of work around suicide prevention and suicide research. And so I would just like to say welcome, Jacey, to the episode.
Thank you. Been here a couple times, but not as a guest, so this is exciting but different.
Yeah, I should also mention that Jacey is the person who goes through and does all of our podcast editing. So thank you, Jacey, and does all the social media for the podcast. So obviously a very important member of the team. So thank you.
Yeah, of course.
So I think we'll just start out, Jacey, if you could tell us a little bit about kind of your journey and what brought you to the work of suicide prevention and suicide research.
Yeah. So I would say for quite a long time, I've always had an interest in like the medical field, which kind of eventually got more narrowed down and more specifically interested in psychology. I kind of realized this throughout high school, I think. And originally, I was always wanting to do med school with the intention of doing something like psychiatry. College came around and I was pre-med, and I realized after doing 3 years of really hard classes that I didn't think I was the right fit for med school. I kind of explored my other options. And so currently I'm looking to apply to clinical psychology PhD grad school programs. And I've just been doing this work since I graduated my undergrad in 2020. So when the world started ending is when I ended my college undergrad career. So I have Bachelor's of Science degrees in biological sciences and psychology. And I think that a lot of different experiences in my life have kind of led me to be more passionate about suicide and suicide prevention in specific. And so for me, I have a history of mental health issues. I have diagnosed depression and anxiety, and that's something that I dealt with pretty heavily when I was in high school, and had suicidal ideation pretty severely. And it's something that I can very happily say that is very well managed now and not really a concern for me. Mm-hmm. But it's something that definitely shaped where my passions lie, how I view the world, what I want to do with my life, and the way I, look at people's behaviors and words and all sorts of things. And another kind of impactful experience for me was I am also a suicide loss survivor. So I had a friend in high school who died by suicide my senior year of high school. And so experiencing that, kind of in a time where I felt like I was starting to get a handle on my own mental health issues,
Mhm.
losing somebody in that way and experiencing that very unique grief also just was another factor that really pushed me to this space. And I always kind of knew that suicide prevention type of work is something I was really interested in getting involved in. In what capacity, I wasn't really sure. Once I kind of figured out what I want to do post bachelor's degree, I started to try and get more research experiences, which is what brought me to Milwaukee originally. I'm actually from Nebraska. Go
Mhm.
Huskers.
Nice.
um, and yeah, so I came here towards the end of 2020. I was a clinical research assistant in Dr. Durun Cassini's lab doing PTSD studies after traumatic injuries at the medical college. And through that, I met Dr. Schramm, who is not here, but was kind of my first connection to the suicide and suicide prevention research world. And so I got involved in some of his studies and kind of
Mhm.
became more active working on suicide prevention in trauma centers. And then that's through him how I met you, worked with you a little bit more. And then it was kind of perfect timing that, you were starting to look for people to join your team in the Division of Suicide Research and Healing. And I had really gained, a lot of experience in research post grad. And yeah, it just worked out really well. And so that's kind of just the journey leading up to, I guess, where I am now.
Yeah. 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 Dr. Shram, Andrew is not here today, but he's here in our hearts for sure.
Yes. Yes, yes.
Yeah, it's always interesting talking to people that work in this field. It seems like all of us, or many of us, most of us, have some sort of lived experience, whether that is with our own mental health issues, whether we've had, suicidal ideation or a suicide attempt history, or being a loss survivor. I think that it's just amazing what kind of passion that inspires in people. So I appreciate you sharing your background and your journey and what you've gone through. None of it's easy. And at the same time, it's really nice to work with wonderful people like you that have, weathered some storms and are now trying to make a difference. So it's great.
Yeah, thanks.
So I'm going to ask you the question that I ask a lot of guests, and I
Okay.
didn't tell you I was going to ask you this, so
Okay.
hopefully I'm not putting on spot too much. But as you think about what you've learned about suicide over the last several years, what is one thing that you wish everybody knew?
Yeah. I think the biggest thing that I have learned, and I wish I knew back when I lost somebody to suicide myself, is that and a lot of people podcast before, so this isn't new information for people who have been listening for a while, but it's primarily a systems issue.
Hmm.
Um, I wish I would have known that sooner, so I could have been able to work through the like self blame and guilt aspect of grieving somebody who's died by suicide.
Hmm.
Um, but I think that what a lot of people don't realize, and because it's not talked about as much, is that a lot of the things that contribute to a suicide death are not just mental health issues. It's all sorts of environmental and contextual factors. It's all of the systems in our country. It's
Yeah.
familial systems. It's support systems. It's financial work. Like every everything. It's there's so many things that are so much bigger than us that need work that are affecting people very negatively to the point where taking their own life feels like a better option than
Yeah.
living through that pain. And I think as great as it is, and as much as we need to keep encouraging people to, check in on your loved ones and be kind, it's also not an individual's responsibility to keep somebody from dying by suicide. And
Hmm.
we don't ever really have the power as an individual to do that either, because we can always be there for somebody and there's still going to be these that we can do everything we can to help with, but we can't, just fix it.
Yeah.
Um, so I think that partially in the aspect of I wish more people knew that so that there would be less guilt and self-blame when somebody does die by suicide. And I also wish it was something that was more talked about so people knew that suicide prevention isn't just crisis hotlines and like psychiatry and psychology and therapy,
Yeah.
but that it's a much bigger issue, and we need to. I mean, we've done a lot in the space of suicide prevention in recent years, but there's so much more in upstream prevention that needs to happen that isn't happening or hasn't happened. And I wish that was something that more people knew about,
Hmm.
as opposed to, a lot of people, as we've learned from readiness assessments and things, they know of 988 and they know of
Hmm.
maybe another hotline or warm line,
Yeah.
and where they can go if they need to go to the ER or
Right. Right.
or to get a
Yep.
therapist, and that's about it. So
Yeah.
there's we need those crisis resources in place. Like, we need those things for when somebody is at that imminent risk of suicide, but there's so many more things that we could be doing to prevent someone from ever even getting to that point.
Right.
And
Right.
it's a lot of work, and it'll take a lot of time and effort and people. But that's why I wish more people knew about it, so more people were doing that work. And
Yeah.
uh, yeah, I guess that was a longer answer than I planned to give, but
No, and I've never thought of this way from the perspective of a lost survivor and the um power maybe that of the reality that this is not just an individual level issue,
Mhm.
that it's a systems issue. I've never thought about what that statement would mean to a lost survivor. I'm not a lost survivor, so I haven't had that life experience. And
Mhm.
it really makes a lot of sense that, because lost survivors, we know, experience, guilt and shame and, what did I miss?
Right,
Um,
exactly. Yeah,
it's a lot. It takes, like you said, onus off the person and puts it on the system, rightfully so, puts it on the system
right.
in a way that shifts that, not blame, but blame,
Right,
um,
right. Yeah,
to
that's
these,
it.
really oppressive systems that we function in on a day-to-day basis.
Yeah, like, I know with my own experience, and I feel like from people I've talked to who are also suicide loss survivors have experienced similar things, but one of the first things you think is, "Okay, what did I miss?" Or, like, "If only I would have been able to talk to them," or, "If only, you know, I would have put myself in a position where they felt more comfortable opening up to me." And it's always, what did I do or not do that could have prevented this from happening? And I think that happens a lot too, not only with suicide loss survivors, but with people who have loved ones who are struggling with suicidal ideation, or just, really difficult mental health issues or other issues that are causing negative thoughts and feelings, where it's also a thing where it feels so sometimes heavy, and like you're the only one, if someone's disclosing something to you, you have to do something. You have to be the one that keeps them from uh, suicidal ideation getting worse
Yeah.
or suicide attempt happening. When in reality, you know, like, yes, you should be there for your loved one, but ultimately, like, it's not, I don't want to say, I don't know. It's tricky with the words, because I don't want to ever discourage somebody from
Right.
getting somebody else help or being there for
Yeah.
somebody or all of that, but you should never feel like someone's life is in your hands solely,
Hmm.
and that if somebody is in a position of crisis, that you either do the right thing or they die. Like,
Right.
I feel like there's better ways to put this, and I'm not.
No, it makes sense because I
But
think when you are in that situation with somebody, it does feel that way, right?
Mhm.
It feels like, oh my gosh, like I have to do everything exactly right. I have to
Mhm.
say exactly the right things. I have to take exactly the right steps, or something really bad could happen to this person. And that's a very heavy reality to sit with. Um, and I really like what you're saying about, you know, we really, I mean, we're equipped to listen, right? We're equipped to be there and provide connection and support. And we also are human and have limits
Yeah,
and are doing the best we can.
right.
Um, and we have to create systems where people feel connected,
Yeah,
where they feel supported, and that doesn't rely on the person that is helping somebody,
right,
in a suicidal crisis in that moment. It's really up it's on all of us.
right.
It's on yeah, and it's
Yeah,
bigger than us.
yeah,
So
and that's also not to say that I would ever want to anyone to feel discouraged from, like, reaching out to somebody else if
oh,
they're
yeah.
in a time
Yeah.
of need, because every single time, like, I if somebody is experiencing that, I want them to tell me. If I have a loved one who is going through something difficult, I want them to tell me so I can do whatever is in my power to help them.
Yeah.
But there's also so many other factors, and we can't, even though sometimes it feels like, "Oh, I'm this is a very critical situation and all the responsibility is on me," that's not the reality.
Yeah. Yeah. No, I agree with that, and I think, um, acknowledging that is really important, especially for those of us who, support folks
Yeah,
who have been in crisis or, are in crisis ourselves.
right.
Yeah, I mean, reaching out and connecting is really that's what we can do. That's the
Mm,
thing that we can do as individuals, as loved ones, as friends,
yep.
but there's a lot more than that too that needs to
Mhm.
be done. So, there's a couple of things that I wanted to talk with you today, but although we've already had a great conversation. There's a couple of things I wanted to talk to you about today, and that's the work that you've been doing in the division. And this is by far not the only work that JC does in the division. I often say that our research would not happen without her, and it's true. So I just want you to highlight a couple of projects that you've been working on that I think are super interesting and cool. And the first one that I want to talk about is related to your work looking at the intersection of legal issues and suicide. Do you want to talk a little bit about, what drew you to that specific topic?
Yeah, for sure. So when it comes to my, I guess, passion for people who have been affected by the criminal justice system, whether that be someone was incarcerated, they went through a court trial, they are being charged with something, they've been arrested, they've been released, anything, any step in the system. Um, a lot of my passion and I guess compassion for those people too comes from, again, lived experience. So I've had, not, I won't get into any, specific details, but I've had a loved one who was incarcerated,
Mm,
which actually happened during COVID too, which made it even harder.
gosh.
Um,
Oh.
and I think it really opened my eyes to just how broken our criminal justice system is.
Mhm.
It's so much more than just our court systems are backed up and that our jails and prisons are overpopulated. There are so many more issues that you likely wouldn't know about unless you're working in the space or you know somebody who has gone through that.
Mhm.
So for me, my experiences really showed me, I guess, one, how detrimental the way the system is now can be to a person's mental health.
Mhm.
And then once I got more into the work, it's also shown me how prevalent suicide is, not only among people who are in prison, but like people who are in jails and it's pre-trial and they haven't been convicted of anything, or someone who has just been arrested, they were kept overnight and then released. Just that one instance with the system can totally mess with somebody's mental health. And there's a
Yeah.
lot of reasons, why that could happen. I mean, I think one is that in media, it's portrayed a certain way, and your immediate thought is, oh, I'm going to go to prison and I'm going to experience this, this, and that horrible
Yeah.
thing that I've seen
Mhm.
on TV or in movies or heard about. Um, and I think another is just that there's such a stigma around not only just illegal, like criminal charges, but
Mhm.
especially around things like felon statuses, um, and being incarcerated.
Yeah.
And there's just so many things that are in place in the system that don't need to be, that are
Mhm.
very detrimental to people. And so, like, from my experience with my loved one, I had to go through the struggles of um, communicating with them through the system and their rules and regulations. So, like, you think, oh, you can send letters and you can talk on the phone whenever you want, and they have visiting hours. Well, visiting hours are very limited. During
Mhm.
COVID, it was even worse. And when somebody is incarcerated in a prison, they don't really get to choose where they go. So you might not even be in the
Mm.
same state as your loved
Mhm.
one. So that might not even be an option.
Yeah.
Um, there's also with the phone calls, you only get a certain amount of minutes a month.
Mhm.
And then you also can only talk for 15 minutes at a time. You
Mhm.
constantly get a little person in your ear saying, you are on the phone with a inmate at blah, blah, blah corrections. And
Oh.
then it gives you like 60 seconds till you have to say bye. And then it
Mhm.
just hangs up, even if you're not even done with your conversation.
Oh.
And
Yeah.
once you're out of those minutes for the month, you're out of them. And
Mhm.
then there's also email, um, but you have to be able to afford it. And it's not cheap. You get charged for how long you are on the computer as an inmate.
Okay.
So you can, as a loved one, send an email, but it doesn't mean that your loved one prison has the resources or the money to be
Mhm.
able to be checking that every day.
Yeah.
Um, and then I think the other thing too that I never realized is when you send letters and things, one, it takes longer because the corrections officers and stuff like go through
Mhm.
mail and whatnot, which
Yeah.
for contraband and whatever. But they also photocopy everything you send.
Mm.
So letters, cards, your loved one is never getting the original copy of something.
Okay.
And I don't think, one, that people really know that, and two, people realize how much that takes away from the value of that
Mhm.
form of communication.
Yeah. Yeah.
Because any picture you get is going to be in black and white now, and it's going to be on
Mhm.
paper. Um, cards, there's like regulations around birthday cards and greeting cards and things
Mhm.
where like you can only send very specific kinds. Otherwise, they're going to send it back to you.
Oh my gosh. Okay. Yeah, I didn't know
Um,
any of this.
yeah,
Yeah.
yeah, I didn't
Yeah.
either until I was in the situation. And I was like, what?
Mhm.
Why do we have to make it even harder? Why do we have to make things even
Right.
more difficult? Um, and so I guess those are just some of like the little things that are just compounding factors for somebody who's an inmate.
Right.
And that's not to mention like my experience with my loved one who was in prison, the the criminal charges and the system and what they were going through and what the situation was, that didn't affect our relationship or the relationship between them and other close loved ones, but for some people it does. And obviously it makes a difference whether it's like a violent charge versus a non-violent one.
Mhm.
Um but it also sometimes doesn't. There's people who get um caught for like a white collar crime and they lose half their support system.
Right. Right. Yeah.
um
Yeah.
and then on top of that, if you're working in prison, you have limited jobs. You can only work a certain amount of hours. You don't get paid very much.
Mhm.
And if you don't have financial support outside of prison, then you're not going to have any money, especially
Right.
because you probably already had to pay court fees and you have fees when you get out of prison. And if you have restitution, I don't, so many different
A lot.
things.
Yeah.
And when like, talking earlier about systems, when it's the criminal justice system and the prison system, that's one. stressor, one big stressor, but then it's like domino affecting all these other stressors.
Right. Yeah.
So, you're facing incarceration. Okay, now it's I have a work issue because I don't know if I can keep my job.
Hmm.
I now have financial issues because I don't have a good source of income or maybe any income at all. Now I have relationship issues because this is causing strains between me and my partner, or me and my
Hmm.
children, me and my family, me and my friends. Um, and then on top of that, the strain is only going to get worse once you are incarcerated because of the limitations of communication.
Right. Right.
And it's just one thing after another, and it feels like it's never ending.
Hmm.
Um, and I mean, I myself haven't been in that situation, but just from what I've been told and heard about and experienced as a family member of somebody who was incarcerated, like it is beyond what anybody should have to
Right.
deal with, regardless of whether they did a bad thing or not.
Right. Right.
So that's kind of what got me.
That's what got you
um,
started.
yeah.
Yeah. Yeah, and I think, just not just because it's a huge deal, but like the letters and the emails and the phone calls and the visits, connection is so protective against suicide, and limiting that, even opportunities for that connection, and how much that can negatively impact somebody's mental health. Just that piece of what's happening.
Mhm.
Um Yeah, I mean, I think you've done a good job of outlining, a lot of the factors that go into kind of this puzzle. So I don't know if I told you the story, but I was pretty recently on a trip where I was talking to some folks in a community here in Wisconsin about suicide prevention efforts. And I was sitting down at a table at a dinner with a group of people. And a woman who was part of this group came and sat down, and she and I hadn't met. She doesn't know what I do. She didn't know what I do at the time. And she was talking about her granddaughter, who had substance use issues and was incarcerated for possession. And because of her incarceration, was separated from her kids. She lost her job, had really, really tough financial trouble, was, losing her home because of it. And the woman, again, without knowing what I do, said, and they want to talk to us about suicide prevention. And I was like, oh, yeah. It really is a domino effect. And it's when we talk about, quote unquote risk factors for suicide, we talk about disconnection and financial issues and employment issues and relationship issues. And all of that is happening,
Mhm.
on top of this really stressful time in a person's life.
Yeah, and that's another, example of upstream prevention and things that aren't centered around a crisis situation still being considered suicide prevention,
Right. Yeah.
um, like assistance with finances or finding a home or a job or any of that kind of thing is considered suicide prevention,
Yeah.
which
Yeah.
is why the
Should be.
systems aspect is so important.
Mhm.
But yeah.
Yeah. So the study that you're working on, I'd love for you to tell folks, like, what you're actually doing, because
Yeah.
it's a lot of work, and maybe what you're sort of finding as you're doing this work, because it's an in progress study.
Yes.
But
Mhm.
yeah, I would just be curious to hear about that.
Yeah, definitely. Clearly I can talk about this for a while.
That's great.
Um, so I kind of, stemming from this being something I'm really interested in learning more about and doing more work on, had conversations with both you and Andrew and was able to um, get into some data. So for this, I've been using the Wisconsin Violent Death Reporting System data, which, if anyone doesn't know what that is, essentially it's a national database, but the one I'm looking at is state specific. But essentially, it takes law enforcement and medical examiner reports and essentially codes those into ways that is easier to do like quantitative research, and is able to note, different stressors and factors that happened to somebody who died by suicide within the years that you're looking at. So if you listen to the last podcast episode, Sarah talked about how she used the same data for her farmer research. And so one of the things that it notes is whether this person had a criminal legal issue, a civil legal issue, recently released from a corrections facility, or if they were in custody at the time of their death. So through that, I've been able to kind of see, how many people we have like a 15-year span of data. So how many people who were affected by the criminal justice system are dying by suicide. And it's a lot. And so kind of initially, I just wanted to see, what are different factors that are affecting people in addition to this? Are people being disproportionately affected by this? And things like that. So one of the things I initially found is that males are disproportionately represented at a higher level, and so are African American or Black people and American Indians. This is also consistent with mass incarceration and who's most affected by that. So it makes sense that, there's a larger portion of African American and American Indians that are dying by suicide in prisons or affected by like criminal legal issues, because there's more people in these categories that are affected by the justice system. And so that is kind of like a double-edged sword type of thing. Like. So that was one of the first things I kind of noticed. Another thing that I looked at, so there's lots of different, like I said, factors and risk factors and stressors, and people who are experiencing a criminal legal issue or who are an inmate or who recently released are much more likely to be experiencing a number of other factors, basically almost every other stressor that is listed in this data. They're statistically significantly more likely to be also experiencing that in addition to the criminal legal issue, which sometimes has to do with the criminal legal issue, sometimes it doesn't, sometimes both. Something that I guess I didn't mention that I found kind of prior to diving into this, just as like background info, is that the rates of suicide in prisons and jails are much higher than the average populations. So the data that I have, this is from when I kind of presented on this like a year or two ago. So it's from 2019. I looked up to see if there was newer data, and there's not, which is another issue with the system, is that it is not updated in real time very much. But for what we do have, just kind of comparing the rates in the United States, 13.9 per 100,000 people die by suicide. When you look at federal prisons, that jumps to 20 per 100,000 inmates who die by suicide. State prisons is 27, and then local jails is 49 per 100,000. And this is even like on top of this is potentially being underreported, because there are suicides that are happening in prisons and jails that might not be getting recorded as such, or maybe they attempted suicide, but they were transported to a hospital and then they died at the hospital. That's not always included in this data. So that's probably even a larger number than that. And I think one really important thing to think about with these numbers is that when you're in prison or in jail, you are watched all the time. You are on a very strict schedule. Everything you do is recorded and mandated, and you are supposed to be where you're supposed to be at all times. So the fact that this many people are dying in places where they're supposed to be being watched and I think another thing with the data, especially looking at jails, is that a lot of people in jails, more than half of people in jails, are there on pretrial. So
Okay.
they haven't even been found guilty of anything yet. It could be any charge, and that could be because it's a violent charge and they have to be
Sure.
in jail for pretrial because that's what the judges sentenced them to. But there are way, way, way more people who are simply in jail pre-trial because they can't afford bond or bail.
Yep. Yep.
And so, I mean, obviously, again, that's going back to the financial issues thing, but
Hmm.
the fact that you have to pay your way out of jail for something that you might not have even done
Yeah.
is also
Yeah.
kind of wild.
Never thought of it that way, but that's right. Yeah, that's
Yeah,
wild. Yeah, and
yeah,
definitely contributes to that financial burden that folks experience.
yeah,
Um, yeah, I know that I've heard you talk about those rates before, but I guess I didn't remember how stark they were, particularly with local jails. I think
yeah.
that's super interesting. Do you know, have you seen anything in the literature about why it's so high in those facilities specifically?
I have seen a little bit. So some of it is because in jails, people are being arrested and they're being brought in, they're being
Hmm.
released, and it's so overpopulated. So I think it's harder in that instance. Although another factor is that sometimes corrections officers just aren't doing rounds as often as they're supposed to be.
Right.
Um, Sometimes when people get put on suicide watch, they aren't being watched like they're supposed to.
Yeah.
And I was looking at something earlier today. Don't know if I have it pulled up here somewhere or not. But essentially, there's also a noted issue with screening tools. So when somebody comes into jail or prison, either one, you're being asked suicide screener questions. But a lot of times it's the people who aren't screening positive who are the
Hmm.
ones who are dying by suicide. And it's often very early in their sentencing too.
Yeah.
Same thing with when people are being released. It's
Hmm.
within the first week of being
Yeah.
released, often the first couple days, that
Hmm.
somebody is dying by suicide. Um, I think there would be more suicides in jails and prisons if guns were there
Yeah.
because of the impulsivity factor and
Hmm.
that access to lethal means. Um, which is why I think that sometimes something else that I guess I'm seeing. So like I guess something I started working on with this project after doing a lot of that initial data analysis was
Hmm.
diving more into the law enforcement and medical examiner reports.
Yeah.
Um, because although I am easily able to see like, okay, this person had a criminal legal issue or this person was incarcerated in prison at the time of their death, I don't know why they're there. I don't know how long they've been there.
Yeah.
Or if it's someone who's released, I don't know when they got released. I don't know what their recent arrest was for, whatever it may be. So I've been doing a more qualitative approach to it,
Hmm.
and finding, okay, well, what are the reasons most often why somebody who dies by suicide and was recently released from jail or is in jail or prison, whatever it
Hmm.
may be. What are the charges most often? What is the timeline like? What part of the justice like process are they in when this happens? Did they have a court date recently? Things like that.
Yeah.
And one thing that has been, I haven't not quite done with it, but I've gotten through a lot of it. But one thing that has stood out is that it's a lot of OWIs or DUIs, whatever you want to call them.
Yeah.
People will get arrested for a DUI, whether it's their first one or their fifth one or whatever.
Yeah.
And they go to jail, and then they're released, whenever they're able to, when they're not no longer intoxicated or someone's able to pick them up or whatever it may be.
Hmm.
Um, and within like such a short amount of time, those people are dying by suicide.
Yeah.
And again, it's, they haven't been convicted of anything. They haven't been sentenced to anything. If it's their first DUI, they probably won't even get jail time or prison time.
Yeah. Yeah.
Um,
Yeah, in Wisconsin, it's
It's
a traffic citation.
yeah.
Yeah.
But yeah, it's a lot of DUIs. But basically, so far what I found is that we don't have good enough suicide screeners, and people are not being protected who should be, who are having suicidal ideation when they are first entering the system.
Right.
People are being released and just they're out on their own with all of these new thoughts and these new issues, and there's no safety planning, there's no screening somebody out of jail or prison,
Mhm.
there's no setting them up with treatment or anything like that. They're just released.
Yeah.
So I think that's another gap. And then a lot of times it's like court dates. So, people are either they have a court date coming up that day or that week and they miss it because they it, it's just too, whatever is all going on and they ended up dying by suicide before the date, or they go to where it goes really horribly and then they die by suicide after.
Right.
So there's not, resources in court systems that should be there. And then when somebody's released from prison, like they're not given many resources
Hmm.
to adapt and adjust to being back on
Yeah.
the outside world where they're
Society.
not constantly being told what to do. They
Hmm.
now have to find a job, you have to have somewhere to live. And at the same time, you're still paying off fees from whatever it was that
Right.
you were convicted of.
Hmm.
So there's a lot of different places in the process that there could be prevention strategies implemented, and they're just not. And it's a lot. I mean,
Yeah.
it's hard to
Yeah.
read sometimes, like
Oh, I'm sure it is. Yeah. I mean, I've done work reading those narratives and those reports, and
Mhm.
it's difficult. And at the same time, that's where a lot of the good information is.
Yeah,
So I mean, thank you for doing that work. I think it's
yeah,
really important. And it's really, we've done other studies um that have looked at criminal histories of folks in Wisconsin who have died by we there was one study when we looked at criminal histories of folks who died by homicide and then suicide, and sort of looked at, what the legal histories of those folks were in those groups. And for the folks who died by suicide, it was overwhelming how many folks had just a couple of OWIs, maybe one OWI,
yep,
not very many violent crimes. But I think, there we're seeing the intersection between substance use and mental health,
yep,
in addition to the other stressors that are inherent with, you know, encounters with the justice system.
mhm,
And
mhm,
so, yeah. And you've talked about this a little bit, in terms of better screening, the provision of resources
mhm.
for folks, as they're entering the justice system and as they're leaving the justice system. What do you think are some other answers to this issue?
More training.
Okay.
Currently in Wisconsin, at least, corrections officers get 2 hours of suicide prevention training
Okay.
annually.
Okay.
So 2 hours for a whole year. When
Yeah.
I don't think I said this before, but when suicide is making up over half of the deaths that happen in jails and
Yeah.
prisons.
Yeah. Yeah.
More than homicides, more than physical health reasons, more than dying
Yeah.
of old age, anything.
Wow.
Um,
Yeah.
they're getting 2 hours of training. So that's
Okay.
one thing.
Yeah.
I know Wisconsin also has a alternative like treatment and diversion program. I don't
Mhm.
know if there's really data out there on like how often that's being used or what kind of results we're seeing from that, but that is a system that I think should be built upon, especially when it comes to people who are being incarcerated for drug crimes.
Yeah.
Um,
Nonviolent. Mhm.
mhm. So, getting them into a facility that could better help with substance use rehabilitation,
Yeah.
I think is extremely vital. I
Mhm.
mean, like it's known that like there are ways to get drugs and stuff when you're in prison, But I don't think people realize how many people in prison have substance use issues that are so bad that they're in prison saying, I'm gonna get out and I'm going to go get drugs again right
Right,
away.
right.
Like,
Mhm.
it's not deterring them. The whole
Right,
point of incarceration, at least originally, was to rehabilitate
right,
offenders.
right.
But how can you do that with people who have substance use issues and whose crimes involve substances when you're
Mhm.
just throwing them in this disruptive system, then
Yeah,
releasing them, and
right.
they have access to all the same contacts they did before,
Mhm.
who they were getting drugs from. And so that's, another thing that I think should be more available and utilized more. Um, I feel like I had something else too, and now I'm
That's
not
okay.
thinking of it.
That's okay. I mean, I think that's a really good set of, recommendations, many of which are, to your point from, the beginning of this conversation, systems and policy related that, could be implemented to make the system more supportive
Mm,
for folks, regardless of their criminal history or their legal history, creating those supportive systems. I know that there are, veteran courts in Wisconsin, which I think are great. There are some drug courts in Wisconsin. But yeah, to your point, I think more of that would be wonderful to see.
yeah. The other thing I think this is what I was thinking of is that I don't have, hard data on this either, but from people who I've seen on, like social media and stuff who either are or used to be, forensic psychologists or psychologists or psychiatrists in corrections facilities,
Mhm.
they are they're very few and far between, and it is very hard for inmates who are asking for these services to actually get them.
Okay.
A lot of times, that's not, I think, with the overpopulation, corrections officers have a million and one things to do. That's not the top of their priority list. Is
Sure.
this person says that, they are feeling really depressed. And so, like, they want to see somebody and they're like, okay, yeah, we'll get you to somebody. But when
Right.
that happens, who
Hmm.
knows? And then the
Yeah.
other thing that I also thought of is that when it comes to suicide watches, they are almost always being put into a single cell unit. And there is a researcher who was at a conference that I went to last year, and I don't remember which one it was, and I don't remember what his name was, but he does research on solitary confinement and the
Mm.
effects that that has on a person.
Yeah.
And all I really have to say about that is whether it's for a suicide watch or it's because it's a punishment or whatever, that is cruel and inhumane and
Mhm.
should not be allowable under our country's constitution.
Mhm. Yeah.
It is absolutely bonkers the
Hmm.
effects that being in solitary confinement, even for like 48 hours,
Yeah.
the effects that has on your mental health and your psyche.
Right. And for somebody that's already struggling, they
Yes,
don't need isolation, they need connection.
exactly,
Yeah.
exactly.
Yeah.
And if anybody wants to learn any more about real life case of that, look up the Khalif Browder story. It
Mm.
is heartbreaking.
Yeah. Yeah.
Um,
I've read about that.
yeah, there's a
Absolutely.
docu series on Netflix, I believe. And they were interviewing him after, and they had footage from when he was in Rikers jail.
Yeah.
And I mean, this is one of those cases where he was in jail pre-trial. He couldn't afford to get out on bail, but he didn't even do the crime that it was that he was there for.
Yeah.
And it took years for him to be released and to be found not guilty, but he was put in solitary confinement so many times because of other people and situations and just violence and um,
Mhm.
to the point where he wasn't the same person when he was released, and he didn't have any resources when he was released, and then he ended up dying by suicide. So it's just
Right. Right.
absolutely heartbreaking. It's like one of the most glaring examples of how
Mhm.
wrong this system treats people.
Yeah. Yeah. Yeah, it's a really heartbreaking case, and I think the work that you're doing and the work that others are doing in the space is just so important to bring light to this issue and advocate for folks who, don't often have a voice in these systems and in our society. Um, yeah, so thank you for the work that you're doing on this,
Yeah,
and I'm really looking forward to seeing, as you're finishing this up and getting it out there. Just really excited to see where the work takes you.
yeah,
Yeah, because it is so important. So thank you for doing it.
yeah. I'm excited too, and thank you for giving me the opportunity and the space to do this work. I
Yeah,
wouldn't be able to if I weren't here. So,
yeah, of course, of course. And we were going to talk about another study that we do, but like we've already burned through an hour talking to each other. So I
I
think
did
this might
not
be a
expect it.
no. And so I think this might be a two-parter, which is great, totally
Could
fine.
be.
So we'll come back and maybe Andrew will be able to join us this time and
Hmm.
talk a little bit about another cool study that we're working on related to offering suicide prevention in tattoo shops.
Hmm.
So just a little bit of a teaser for a future episode. Do Is there anything that you want to leave us with, JC, that we haven't already talked about today?
um, not that I can really think of. Just,
Okay,
remember that you're important and you're loved, and don't be afraid to reach out for help.
that's
And
awesome.
yeah.
That's a perfect way to end this episode. Thank you, JC, for all the work you do. I
Yes, of
appreciate
course.
you, and it's a real joy to work with you.
Yeah, same to you.
Just a final reminder for our listeners, there are resources available if you are concerned about yourself or a loved one. In addition to the resources that I mentioned at the top of the episode, I do want to mention a relatively new resource if you're in the state of Wisconsin. It's called Uplift WI. Uplift WI was launched in July of 2023. And it is a line, not necessarily a crisis line, but a line that folks can call that is staffed by certified peer specialists. Uplift WI can be reached by calling 534 202 5438. The line is fully anonymous and confidential. It's not connected to any crisis linkage services. And Uplift WI will not call emergency services on you unless you request that from them. And so if you are ever concerned again about yourself or a loved one, Uplift WI is a resource that you can contact in that time. And we will see you for our next episode. We will be talking with Terry McGuire from the Giving Voice to Depression podcast. Terry is an amazing mental health advocate, suicide prevention advocate, and I'm so excited to talk with her. Thank you so much.
Thank you.